I was just asking her, help me out, I'm going through this, you've been through it.
Breast cancer rates are rising for a specific population of women under age 50.
Hand sanitizer is not going to do it. You need soap and water.
How to avoid a new strain of norovirus that is spread across the country.
I just started feeling so much better. My sleep was better.
And Dry January. We'll look at the benefits that can come from a month of sobriety. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We begin with the wildfires in Southern California. As residents there deal with unimaginable loss, about 17 million people are facing health risks from the smoke.
The amount of smog and toxins in the air, it's like, even though our house is spared, obviously we're probably not going to be able to move back in for months.
Pollution can linger at dangerous levels long after the fires die out, and across the region, officials are warning people to protect their lungs. Many are wearing masks when they're outdoors, concerned about what's in the air.
I've woken up with burning eyes and a sore throat, coughing. I've had friends talk about getting nosebleeds. It's just awful. I'm sleeping in a mask.
Doctors say smoke can be particularly dangerous for those with asthma or heart conditions because of all the irritants and toxic chemicals in the air from burned homes, vehicles, and objects when wildfires enter urban areas.
There's a lot of stuff in wildfire smoke that can be damaging and irritating. There's the PM 2.5, the really small particles that we inhale that can cause inflammation, but there's also a lot of noxious gases and fumes in this wildfire smoke as well, and they both can be irritating to the lungs. And one of the scary things, though, is that the small particles actually can get taken up by the bloodstream. It can actually increase risk for cardiovascular disease, heart attacks, and strokes as well.
What can people do to protect themselves?
So I'm recommending, if they can, stay indoors, keep the windows and doors shut. If you have a central HVAC, you can run that. That's got filters. If you've got a home air filter, you can run that. If you're going outside, wearing an N95 or a KN95 will help, at least with the particulate matter. And if you're in the car, make sure you've got the recirculate air actually turned on to kind of prevent that polluted air from getting inside the car.
A record 24 million people have signed up for the Affordable Care Act this year. The government marketplace for health care coverage, also known as Obamacare, was recently expanded. President Biden signed into law billions of dollars in tax credits that increased the number of people who qualify and lowered its cost. Now millions more Americans can pay monthly premiums of just a few dollars to get coverage.
If you have more than 300 million Americans with health insurance coverage, that means you have fewer Americans, record low number of Americans who have no access to health insurance, uninsured, which dipped below 8%, got to about 7%. No president has done that before in the history of the country.
But the ACA faces an uncertain future under a Republican-controlled White House and Congress. President-elect Donald Trump has long vowed to repeal the ACA, but was unable to do it in his first term when the number of enrollees was just half of what it is today. Open enrollment for the ACA this year ends January 15th. Even with health insurance, a medical crisis can financially cripple someone. About 14 million Americans now carry medical debt that shows up on credit reports. It can make it difficult to take out loans, rent a home, or even apply for jobs. But as CBS's Nancy Cordes explains, a new rule issued by the outgoing Biden administration could change that.
The world's best medical care doesn't come cheap. More than 40% of American adults say they're in debt due to medical or dental bills.
Every credit card I've applied for has denied me.
Harley Meir lives in northern Wisconsin. An emergency flight for a seizure when she was 18 left her $100,000 in debt. Her credit score is still below 500.
My husband and I are first-time home buyer. Well, he was a first-time home buyer. When they ran my credit, they're like, you can't even be on the loan.
All that is set to change due to a new rule just finalized by the Consumer Financial Protection Bureau. The rule will prevent the 3 credit reporting agencies from including past due medical bills in credit reports. CFPB predicts the move will lift the credit scores of about 15 million Americans by an average of 20 points.
Medical debt does not predict whether you are a high-risk person to lend money to.
CBS medical contributor Dr. Celine Gounder.
This is not people being irresponsible, going out shopping with their credit cards, spending more than they can afford. These are situations of life and death oftentimes.
Mir is hoping she'll finally qualify for a car loan. Her 3-year-old son has Down syndrome and sees a specialist 2 hours away.
I will admit, when I got the message today, I did get a little teary-eyed. I'm honestly in shock that it has happened, and I'm very grateful that it has happened.
The rule is set to go into effect this spring, and the banking industry has been arguing that the rule is going to hurt borrowers by giving them access to more credit than they can actually afford. Congressional Republicans have been urging President-elect Trump to reverse all of these new rules and regulations the Biden administration is approving in these final months. And so this is not quite a done deal yet. Nancy Cordes, CBS News, Washington.
The Biden administration says it plans to create a vaccine stockpile to guard against a new bird flu strain in poultry. The announcement follows word from the Centers for Disease Control and Prevention of the first human death from the virus. Louisiana health officials say the patient was over 65 years old, had underlying medical conditions, and was hospitalized last month with severe respiratory symptoms. That person was sickened after being exposed to infected wild birds and a backyard poultry flock. The CDC says the strain showed some potentially worrying mutations that might help the virus infect people more easily. But Louisiana health officials say there is still no evidence of human-to-human transmission. The CDC says the current risk posed by bird flu remains low for the general public. CDC officials tell CBS News a new strain of norovirus is now everywhere in the U.S. The strain, called GII.17, is part of an unusual wave that originated in Europe and Asia and now accounts for 7 out of every 10 stomach bug cases in the U.S. A different strain was responsible for most cases over the last decade. I spoke with infectious disease doctor Daniel Karitskas from Brigham and Women's Hospital to learn more.
It means that people's hands get dirty when they go to the bathroom, and then they spread the virus. It doesn't take very much virus that's shed to contaminate your hands, and it causes vomiting and diarrhea.
Norovirus can also cause nausea and stomach pain, body aches, headache, and fever. The virus is not easily treatable and is highly contagious. It can live on surfaces for weeks, so doctors say it's important to use disinfectants, and the most important way to prevent the spread is to wash your hands with soap and water.
Is hand sanitizer effective against norovirus?
Hand sanitizer really doesn't do the trick for norovirus. It's good against respiratory viruses, but norovirus is a much hardier virus. It really needs soap and water to be able to inactivate it.
Speaking of viruses, there's been a surge in the flu, RSV, and COVID since the start of the new year. CBS's Stephanie Stahl breaks it all down.
It's a new year, and we're starting 2025 with the same old respiratory viruses. 40 states, New York City and D.C., are reporting high or very high levels of flu activity, according to the latest CDC data. Emergency department visits for RSV and flu are very high and are increasing for COVID-19 from low levels nationally.
I thought it was a sinus infection. I had no idea.
Pam McLaughlin went to urgent care with postnasal drip and a strange burning sensation in her nose.
The doctor came. She said, "I'm shaking my head because you got a double whammy. You have COVID and the flu."
Doctors say some people have built up immunities from previous infections and vaccinations, which can make symptoms milder. But there's also a growing number of people with serious complications.
And over the last week, it started reflecting in our hospitalizations and admissions, where it starts to become challenging to our staff.
Dr. Martin Topiel with Virtua Health says RSV, another respiratory illness, is also spiking. All the contagious infections probably related to holiday gatherings when people are in close contact.
Do you expect this increase to continue now post-holidays?
Yeah, I think the next 3 to 4 weeks may be very difficult.
He says infections are being spread quickly by many people who don't realize they're contagious.
Be careful, the slightest thing, just go get tested. It's better to be safer than sorry.
And doctors say it's not too late. Vaccines are still available for COVID and flu for everyone, RSV for people at high risk. I'm Stephanie Stahl, CBS News, Philadelphia.
Scientists have discovered the rate of breast cancer in a specific group of women is increasing faster than in any other group. They're young women of Asian American, Native Hawaiian, and Pacific Island descent. CBS's Elaine Quijano looked into why.
How are you?
It was a personal college reunion, 18 years in the making. Regina Chincio Kwong and Canny Yu Lepak first met here at UCLA as freshmen. Now, decades later, they've both walked a path neither wanted to take.
You helped me so much and you don't even know it.
Oh, I'm so glad.
Yu Lepak was just 40 when she received life-changing news. What did the doctor tell you?
She told me, yeah, the results are in, and unfortunately you have breast cancer.
2 years later, Chincio Kwong's mammogram showed something suspicious.
I was in shock. I was expecting a completely normal mammogram. And then what I found was, wait a minute, Asians have a rising level of breast cancer. And so I was surprised that I missed that.
Good morning, everyone.
Even though she's a public health doctor, Chincio Kwong was unaware of a puzzling trend. A new report by the American Cancer Society found the rate of breast cancer among Asian American, Native Hawaiian, and Pacific Islander women under 50 is rising faster than in women from any other racial group. Asian Americans make up the fastest growing racial demographic in the U.S., but only 1% of medical research dollars have been spent on studying the health risks of the many ethnic populations within that group.
It has been a battle every step of the way.
Congresswoman Judy Chu represents California's 28th district, where 38% of her constituents are Asian American.
It's so important to break down the different sub-ethnic groups that comprise our population to see what the differences are. If we don't have that information, we don't know how to target the solution.
For Canny Yu Lepak, those solutions include more openness about health problems in Asian American households. So did you talk about health issues growing up?
No, you only went to the doctor if you had to go to the doctor. So prevention was not something we ever even thought about.
But now she's trying to change that.
Hi, I'm Canny.
Sharing her experience with other women.
Advocate for yourself when something feels off.
I couldn't believe that she had cancer and I didn't know it. And I was telling her, I have cancer. And I was just asking her, help me out, I'm going through this, you've been through it.
Both women were diagnosed early and are now cancer-free. They also share a new appreciation for the power of prevention and friendship.
The things that brought us back together was something you don't want anyone to have.
Right. Before having the diagnosis, I think I took a lot for granted. But then when you have cancer and you see the other side, the world looks so much more beautiful. And you're hoping that you're going to be here forever to enjoy it.
A new study finds about 1 in 3 pharmacies have closed in the U.S. since 2010. From mom and pop independents to big chain drugstores, this trend has a serious impact on healthcare across the country. Here's CBS's Mark Strassman.
Until someone invents time travel, let's prescribe a trip to Kempson Rexall Drugstore. From medicine to milkshakes, a taste of what was in the here and now.
This store means the world to this community.
In Inman, South Carolina, Marianne McElveen's the pharmacist, the owner, the custodian of this presence on Main Street since 1905.
Our customers are extremely loyal. They love us. They love the personal feel that they get, the attention they get.
For Inman's 3,200 residents, the nearest hospital is a half-hour drive away. In family medical moments, big or small, they often call here first.
Get you some of those.
4 generations of Rhonda Glover's family come here every week for something.
Whatever you need, they'll provide it.
Are you worried they could close?
Yeah, it's kind of a hardship.
Like many independent drugstores, this one needs a shot of hope. Prescription reimbursements are falling from insurance companies. Shopping habits are changing. Even the big pharmacy chains are shuttering thousands of stores. Walgreens just reported an $8.6 billion loss last fiscal year.
We've had to make some adjustments, some changes. We've had to cut some hours, just doing anything we can to stay alive and to keep the doors open.
Nerve-wracking?
Yes, yes. There have been many sleepless nights.
Across the U.S., at least 7,000 pharmacies have closed since 2019. Of those, roughly half were independent drugstores.
They're not going to drive 30 miles away to a hospital for a sickness. They're going to go to their pharmacy first.
Professor Laurie Trudell studies small businesses at Clemson University.
I mean, when you think about the thousands of pharmacies in rural communities that are closing, you're losing access to all health care.
In the back end of the store, the pharmacy itself, the profit margin's thin, 3 to 5%.
Especially expensive brand name medications, we fill those and we may not be reimbursed even at our cost for those drugs.
What is sad about it?
It's sad to me that that part of America, that part of business would go away. We're not going to throw in the towel. We're in it for the long haul.
But ask any pharmacist, there's no magic pill for that. Mark Strassman in Inman, South Carolina.
After the break, the latest research on the healthiest time of day to enjoy a cup of coffee. And we'll tell you about the big benefits that can come from a short break from alcohol. Welcome back. If you're looking to get a health boost from coffee, it matters when you drink it. A study by the European Society of Cardiology found morning coffee drinkers had a lower risk of death from cardiovascular disease and a lower mortality risk overall when compared to all-day coffee drinkers. One possible reason is drinking coffee in the afternoon or evening disrupts the body's circadian rhythms. Alcohol is also having a moment with conflicting studies and recommendations. The World Health Organization says all alcohol is dangerous and there is no safe amount. And the U.S. Surgeon General wants to put a label on all of it, warning there are 7 different kinds of cancer linked to alcohol. On the other hand, the U.S. National Academies of Science, Engineering, and Medicine found there is evidence drinking moderately actually lowers your risk of death from any cause compared to not drinking at all. But a growing number of Americans are using the month of January to sample sobriety without being overwhelmed by the idea of giving up alcohol forever. This old-fashioned is a new recipe made from a non-alcoholic alternative to whiskey. Julie and Reed Robinson are co-founders of an alcohol-free bottle shop in Richardson, Texas.
I stopped drinking about 3.5 years ago.
At first, Julie attempted to go dry-ish.
I was going in with just a plan to still be a mindful drinker. I just started feeling so much better. My sleep was better. I had more clarity. And I thought, I'm just going to keep going.
Their shop gets more customers this month as more people reflect on their relationship with alcohol in the new year. Jessica Benovic is a psychiatric nurse practitioner with the Cleveland Clinic. She says the health benefits of not drinking short-term are huge.
Immediately, patients feel better, their sleep is improved, concentration, memory levels are better, your blood pressure comes down, your cholesterol levels come down. We know alcohol is a depressant, so it immediately boosts your mood. It helps with anxiety and depressive symptoms.
For those that are trying dry January, but they find that they do have a drink, what's your advice?
Yeah, that's a very common thing. A lot of patients feel like it's all or nothing, and it's not. I think any sobriety is better than no sobriety. If you slip, that's okay. Just start over tomorrow.
There are also apps that can track your progress, even keeping count of how many calories you're not consuming. A nudge to nix the alcohol that may lead some to try a sober spring. Coming up, a new best friend for seniors with dementia and the health repercussions that can come from multitasking. Welcome back. If you're like most Americans, you have a lot on your plate at any given time, and you've probably become pretty skilled at multitasking. CBS's Dr. John LaPook explains why it may be better for your health to slow things down.
Even though this may look like a perfect example of multitasking,
It turns out
there isn't any real multitasking.
Linda Stone coined the phrase for what it really is: continuous partial attention.
We don't ever do anything simultaneously. We are just rapidly task switching.
And how are human beings at doing that?
We're not great at doing it.
She spent her career at Apple and Microsoft, watching how humans interact with tech, which led her to focus on the myth of multitasking.
So what is walking and chewing gum at the same time?
I would call that simple multitasking.
But for more complicated things, research suggests the human brain is simply not wired to multitask efficiently, and people overestimate their ability to do it. A study of doctors found multitasking almost doubled mistakes writing prescriptions.
As a physician, I have to multitask at times, so I can't always just do one thing.
That is how we operate as human beings.
If multitasking is what we do and it leads to more mistakes, maybe when we're doing something especially important, we should remind ourselves to keep one ball in the air at a time. Stone says our splintered attention causes more damage than we realize.
Where does the smartphone come in?
The smartphone is amazing. There's so many things we can do. And yet, what happens to the body? We hold it, our neck goes down, our posture, we lose it. We lose our ability to breathe properly.
We go step.
Her approach to the mental and physical stress caused by multitasking?
1, 2.
Dancing lessons at a Boston studio with teacher Bjorn Anselm.
We just want to make this feel as comfortable as when we're walking around.
And I brought along my 2 left feet.
So 1, 2, 3.
How does this help me not to multitask?
You can feel that you are working with me. It's not just you, your phone, and earbuds. You're both connected to me, and you're fully present. Your whole body is engaged in this.
Stone says our brains and bodies need to relax with things like walks outside, humming or singing, an antidote to our constantly divided attention.
I can do this with my heels on the floor.
You won't hear any argument from busy working moms Erica Robinson and Evandisa Cabral.
Do you think we live in a world where there is simply too much multitasking?
Yes, it's like we have to. It's like being a parent. We have to think about what we gotta do for ourselves, what we gotta do for our children, cook, get the clothes ready, make sure they do their homework.
I feel like everyone's brains are always on go. And most times we don't stop to take a breath, even just to breathe for a second.
Living in the moment, a single-tasking prescription for navigating a multitasking world. Dr. John LaPook, Boston.
Finally, this half hour, seniors battling dementia are finding comfort in a new lifelike robotic puppy. Jenny, the robotic Labrador Retriever puppy, responds to voice commands, touch, and even barks and wags her tail. Tom Stevens created the interactive support animal after his mother was diagnosed with Alzheimer's, and her beloved dog had to be taken away.
These puppies are designed to treat the behavioral and psychological symptoms of dementia, reduce the need for certain medications, including psychotropics, and we aim for them to be the first FDA medical devices.
Jenny works just like a smartphone and needs to be charged overnight. She's on display at this year's Consumer Electronics Show in Las Vegas and will go on sale later this year. A high-tech take on man's best friend. That's this week's Eye on Health. I'm Bradley Blackburn. Thanks for joining us and be well.